Thank you for listening to My Pain Web. Despite all that modern medicine offers, chronic pain often worsens and becomes more complicated over time. Connecting to My Pain Web empowers you to take charge of your chronic pain. Will help you achieve some quality of life as you face your own obstacles of living with chronic pain. You are listening to My Pain Web podcast, episode 15, Chronic Back Pain and Back Surgery. Today we're going to talk about the unintended consequences back surgery may have on chronic pain. So let's get started. Hey everybody, Steve Kotick here. Welcome to My Pain Web podcast. If this is your first time listening, then thanks for coming. The My Pain Web podcast is the place where we talk about what it means to be suffering in a pain web. We listen, we share, we connect, we clarify, we cry, and we laugh. Together, we empower and motivate to create confidence, worth, and self-esteem. My Pain Web helps you achieve a quality of life as you face the obstacles of living with chronic pain. You can connect to many chronic pain details and information at mypainweb.com. Come back often and feel free to add the podcast to your favorite RSS feed or iTunes. You can also follow me on Twitter at mypainweb and on Facebook. Now, today's show discusses the unintended consequences back surgery may have on chronic pain. My Pain Web shares with you my personal experiences and my personal understanding of chronic pain and back surgery. In no way does this constitute a medical opinion or negate the advice of your personal doctor or surgeon in any way. My Pain Web's intention is to inform you of my personal experiences and understanding of my almost 20-year chronic pain odyssey. As we all know, no two people are alike, and neither are any two surgeries. We know there are risks involved with certain procedures and any surgery. You are the best one to be advised by your personal physician and surgeon about what outcomes you can hope to achieve. It is in your best interest to be as informed as you possibly can before making any decisions, weighing your options against your own personal judgment or your belief system. Okay, so we're going to talk specifically now about surgery, back surgery, and its impact on chronic pain. Sit back, relax. At any time, you can follow along with some of the details we're going to be talking about in this podcast on mypainweb.com. Click on the PainWeb Help section, and you'll see the invasive surgery box under the intervention button. Pain alone is not the reason for spine surgery. It must be determined that you have some type of an abnormality in your spine that may be best treated by a surgical procedure. So here's what I'm talking about. Here's a few common examples for doing back surgery. Scoliosis, which is a curvature of the spine. Something called kyphosis, which is a abnormal deformity, also referred to as a humpback of the spine. Something called spondylolisthesis, which is a forward slippage of a segment of the spine. There's something called spinal stenosis, which is a narrowing of the spinal canal, typically from a condition like arthritis. There's something called radiculopathy, which is an irritation and inflammation of a nerve caused by a herniated or bulging disc. And There's degenerative disc disease, which is a kind of a catch-all of a number of different disorders that could happen as a result of a disc problem. Spine surgery is, and for the foreseeable future, will remain a controversial topic. We all know people who've had back surgery that even after the back surgery, they still have problems. We also know that some people who do undergo spine surgery have an excellent end result, meaning return of function, mobility, and either an elimination or a huge reduction in pain. So you've got both ends of the spectrums here. Of all the people with back, and will include neck pain, experts state that only about 2 or 3% should ever need surgery. What does this mean? Well, it means that the vast majority of chronic pain, either back or neck, will be successfully treated using non-surgical interventions. There's a common belief among people that if the symptoms are bad enough and you have excruciating pain that won't quit, well, I can always have back surgery. This is simply not true. For most conditions of chronic pain and neck pain, there is no surgical solution. Now, there's a number of different surgeries that are done for some very common back problems. I'll just mention them in name, but again, if you're interested in any of these on a more specific nature, go back to that link, invasive surgery, at mypainweb.com. There's a discectomy, which is a removal of the herniated portion of the disc. There's something called a laminectomy, which is a removal of a piece of bone where there may be causing a problem. There's a fusion, which is a process where they permanently fuse 2 or more sections of bone together in the spine. There's the use of artificial discs, spacers that are used between the vertebrae, and many others. Now, in addition to quite a variety of different types of surgeries for the back, there's a number of different ways that surgeries can actually be formed. There's the traditional invasive surgery that involves making an incision and using instruments or other medical devices for the surgery. There's something more popular called minimally invasive surgery, also known as MIS. This can result in a quicker recovery with a lot less blood loss during the procedure and help the patient speedily return to normal function. They're also referred to as a keyhole surgery, and quite honestly, it's a very tiny incision, possibly the use of an instrument called an endoscope with a camera on the end. So it's not nearly as invasive as the traditional invasive surgery. There's also all kinds of diagnostic procedures that can be used during the surgery itself. Laparoscopy, which is the use of flexible endoscopes for doing back surgery. Lasers are used in back surgery, and cutting-edge technology is actually using robotics for back surgery. So as you can see, the menu of the type of surgery and how it can be done is massive. There's a lot to consider. Now, who performs the surgery? Well, a neurosurgeon or an orthopedic surgeon performs back surgery. This is your choice. See, both neurosurgeons and orthopedic surgeons can perform spine surgery. Currently, Neurosurgeons seek board certification from the American Board of Neurological Surgery, and orthopedic surgeons seek certification from the American Board of Orthopedic Surgery. It's very important that we make sure that the doctor that we select is certified by the appropriate board. Why? Because this ensures that the doctor has met the highest standards set by his or her peers and passed both oral and written examinations. So if you're considering a neurosurgeon or an orthopedic surgeon, you want to know if they're board certified, go to mypainweb.com, and under the Doctor Finder button, with just a few internet clicks, you can determine if your doctor is board certified. And also, and I've done this very successfully, don't be afraid to ask your surgeon about his or her training, their practice focus, their experience with whatever operation has been recommended, and whether you, the patient, have been presented with all of the options that exist, regardless of whether your surgeon performed all of them or not. So my point here, it's worth repeating, is don't be afraid to speak up. It's your body, it's your spine. Physicians place great value on educating patients to the best of their ability so that satisfactory decisions can be made and acceptable treatment is initiated. So here's a few questions that I have used in the past and continue to use to this day. I ask, are you board certified? I also ask, about how many surgeries like this did you do last year? And what were the results, the outcomes? Are the results, the data, available to patients to review? Do you have a sense of how your patients do who choose this particular surgery versus those who choose not to have the surgery? And I really like using this question. What makes you think that surgery is the right course of action? I also want to know, will anything bad happen if I don't have the surgery? And this one I particularly find of significant value is, may I talk to one or more of your patients who underwent this similar operation about a year ago? Now, they may sound like getting a little personal in asking these questions, but that's the idea of it. You need to be assured and reassured on all different levels. Now, when should the surgery be done if one's being recommended? Well, many common back problems, even those that cause severe pain, will resolve themselves over time using conservative therapies and other non-surgical interventions. If you haven't listened to podcast number 5, listen to that one because I specifically outline the conservative therapies. Now, patients without a lot of other symptoms in their legs should generally wait at least 12 weeks. Now, if there's no improvement and the pain is severe and disabling, spine surgery may be an option to consider, provided you've been properly evaluated by at least one surgeon and a second surgeon to obtain a second opinion. And above all, you want to make sure that the cause of your pain has been clearly diagnosed. Now, in the unfortunate circumstance that you have the inability to control your bladder and or bowels, this may indicate a medical emergency requiring immediate medical attention and surgery. And it's also important to note that all conservative therapies and other non-surgical interventions were properly used and trialed prior to a surgery consideration. What I kind of mean here is if the back pain suddenly came on and it's just a couple weeks down the road and you see a spine surgeon or your primary care physician feels you should see a spine surgeon, and right then and there a spine surgery is recommended without trying any other non-conservative therapies, that makes me feel like we could be at the top of a very steep, slippery slope. Unless, like I said before, you've got other very severe symptoms such as the inability to control your bladder, bowels, and a few other ones. So lastly, you have to clearly understand the risks and the benefits of the proposed surgical treatment options. So what are some of these risks and complications? Well, the complications from spine surgery are not infrequent. And the list of complications are enormous. So I have come across a few excellent links that you can find at mypainweb.com. Click on the intervention button under My Pain Web Help, and you'll see the surgery button. Click there, and you can find the links called Risks of Spine Surgery and also Back Surgery that does not relieve back pain. And through those two website links, you can read a lot more about the risks and complications of back surgery. You can also find a huge list located in the links section at My Pain Web. Now keep in mind that before you agree to back surgery, you have to have a second opinion from another qualified spine specialist. Why? Because spine surgeons often hold differing opinions about when to operate, what type of surgery to perform, and whether surgery for some conditions is even warranted. See, this is where the nature of some controversy begins, and we discuss some controversies within chronic pain in detail in podcast number 8. If you haven't listened to podcast number 8, by all means, take some time after listening to this podcast to check that one out. So diagnosing and treating back along with associated leg pain can be a very complex issue, which may require a team of health professionals to diagnose what's wrong and how to treat it. So I'm just going to wrap up a minute here about surgery. It may be the last resort to help reduce your chronic pain, but, and this is a biggie, there is no guarantee that surgery is going to reduce or eliminate your pain. Surgery, back surgery, is controversial with significant risks and complications. It's possible that your post-surgical chronic pain may be worse than before the surgery. And surgery is not a substitute for the conservative therapies and other non-surgical interventions. All non-surgical options really need to be properly used and trialed before back surgery. And also consider this. Back surgery is considered the point of no return. Why do I use that phrase? And it's because most, if not all, surgical interventions are permanent. Now, I'm spending a little bit of extra time on this particular podcast because back surgery has been a big portion of my 20 years in trying to manage my chronic pain. So a couple things about back surgery and what I have done. in the event that you are facing a back surgery yourself, or you may have undergone some spine procedures in the past and you're still experiencing problems. Many, many times people email me, they call me, and they want to know, what have I done? Well, I've asked my doctor in the past if I was a candidate for either a spinal cord stimulator or a device called an intrathecal pump. Both of these are advanced pain therapies that are easily implanted. And while it is a surgical procedure to implant them, these two devices are reversible, meaning if they don't work, they can be removed. That spinal cord stimulator is also known as neurostimulation therapy. And it's basically spinal cord stimulation that's delivered by the way of a small electronic device called a spinal cord stimulator, similar to a pacemaker, that's surgically implanted under the skin. And what it does is it delivers mild electrical impulses to your spine, causing different types of tingling sensations in the area where you feel the severe chronic pain. So basically what it's doing is, instead of feeling your very frustrating, very painful chronic pain, you feel this tingling sensation. The other device, called an intrathecal pump, delivers pain medication directly to the spine. And it's a device that is implanted, and it's very high tech, and it does require added patience from you, as well as some of your participation with your doctor to help ensure that the device provides pain relief. So what is a positive about the intrathecal pump is that there's fewer side effects than taking much larger amounts of oral medication, because the intrathecal pump uses a very, very low dose by compared to much higher doses of oral medication. So both of these implanted devices are effective in helping reduce your chronic pain. But as I mentioned, it takes your understanding and patience to continually work with these devices with your doctor to maximize the benefits. Now, while these devices can work, they will from time to time require your participation. What do I mean? Well, for one, the power source for these electronic devices are located within the implanted device themselves. So what that means is it's a battery, and the device manufacturer for these devices quote a lifespan of about 9 years. So once the lifespan is reached, your surgeon will need to schedule you for a procedure to replace the old device for a new one. And some of these devices, especially the intrathecal pump, require programming from your doctor, along with some available devices that you can use to help the device provide you better relief. So it does take some training on your part to effectively use these. Now, the intrathecal pump may be challenging at times because you may need to trial a number of different types of pain medications until you and your doctor come up with the right type of medications that give you the maximum release. Now, the intrathecal pump uses small catheters that basically deliver the medication from the implanted pump directly into your spine. Now, these catheters do sometimes require some additional surgery in the event that they should migrate as they heal, or if they should become kinked. So what you need to understand here is that these are not just put them in and they're going to take care of your pain. You can see there is some constant tweaking and monitoring monitoring that needs to be done. So you are going to have regularly scheduled appointments with your doctor to refill your intrathecal pump, because over time, as the medication is delivered, the reservoir becomes low of medication. And there's a quick office procedure where your doctor will actually refill the pump with another batch of pain medication. And also, things like the amount of medication that's flowing may have to be adjusted. Now, even the spinal cord stimulator will require some periodic adjustments, but that's relatively easy as there's no medication involved. So, another big advantage to these two advanced pain therapies, as opposed to going in and having a significant spine surgery, is the fact that both of these procedures are reversible. That in the event that the implanted device no longer provide you relief, they can easily be surgically removed. If you at some point click on mypainweb.com, click on the timeline, and then you can view my personal experience in using both the spinal cord stimulator and the intrathecal pump. Now, the technology for these devices are fairly new, and they're still being improved every year. So if you want to know more, you can also click on the links section in mypainweb.com. And there's an excellent resource called Tame the Pain. You can check that out. So, as you can see here, there's a lot to consider with where you are at in trying to manage your chronic pain. You've got the conservative therapies, and then for those of us that the conservative therapies are just not doing what they need to do, there are a couple more advanced therapies, not as well known, which is why I'm taking a few extra minutes here to talk about the spinal cord stimulator and the intrathecal pump. Now, even newer advances are being brought to market for these state-of-the-art devices. One of them is a specialized medication for the intrathecal pump. You see, typically the intrathecal pumps use medications like morphine and Dilaudid with a few other medications, but again, the advantage here is the amount of medication that you're absorbing is very, very small, just a fraction of what you get by taking the oral medications. But a newer medication called Prialt was recently developed. It's a powerful non-opioid pain medication that is synthetically produced from the extremely poisonous venom of the Conus magnus snail. Now, in theory, this sounds like a winner. A non-opioid that can be delivered through the pump to provide pain relief. The problem here is that it's extremely controversial because of the serious physical and psychological side effects of Prialt. It is a non-opioid, so the dependence addiction component is removed, but the side effects are horrendous. How do I know it? Because I personally used Prialt therapy for almost 2 years, and because of the intense side effects, chose to discontinue it. Now, if you want to know more about Prialt, you can also find a lot of information at mypainweb.com on that. Let me just make this note. If you're considering Prialt, if you currently have an intrathecal pump and the current medications are not working, email me, because I think one-on-one we should chat further, because I really question the use of Prialt under any circumstances. Okay, now let's start wrapping this up, because I had mentioned the advantages of something like an intrathecal pump. Well, there is a disadvantage. There is a downside. And that's the fact that they are prone from time to time to having some complication from how the pump itself performs and possible failure of the pump. There could also be complication in the event that the catheter that's implanted as well should become kinked or blocked, so that additional surgery would be required to repair it. So on a final note, these kind of devices, the spinal cord stimulator and the intrathecal pump, will not work for everyone. So some specific patient selection criteria is used in a way to trial these to help determine if using them may work. And if the trial proves successful, then the devices can be permanently implanted. So as we're staying with this topic about surgery, back surgery, and chronic pain, there's a very popular surgical procedure that I've saved at the end here, which is spinal fusion. Now, if a spinal fusion is being recommended, pay close attention. What is spinal fusion? Well, it's a surgical procedure that's used to correct problems with the small bones of the spine, the vertebrae. And it's essentially a welding process. And the basic idea is to fuse together the painful vertebrae so that they heal into a single solid bone. And it's common to add instrumentation or hardware that's implanted in the form of various plates, cages, and screws to ensure a solid fusion. Sounds like a big deal? Surgery, this particular surgery, is a big deal. Now, a spine surgery is usually recommended only when your doctor can pinpoint source of your pain. To do this, your doctor is going to use a number of different imaging tests, x-rays, CT scans, and MRIs. Some specialized diagnostic procedures may also be done to help confirm that a spinal fusion surgery is needed. Something called a myelogram and or another test called a discogram is used to determine if you need the spine fusion surgery. Now, if this happens to be close to what your situation is, again, visit mypainweb.com and you could learn about the many spinal fusion surgeries that I've had. I want to bring up something that has been developing as a result of spine fusion surgeries, and that's something called failed back surgery syndrome, otherwise known as FBSS. Well, failed back surgery syndrome is really a misnomer, and it's not actually a syndrome. It's a very generalized term that is often used to describe the condition of patients who have not had a successful result with a back surgery, and they've actually experienced more pain after surgery. Now, what's interesting here, there is no equivalent term for failed back surgery syndrome in any other type of surgery. For example, there's no failed cardiac surgery syndrome. There's no failed knee surgery syndrome. I'm bringing this up because there's been a dramatic increase in failed back surgery syndrome as a serious concern as a result of additional pain after back surgery. So let me just share with you, and we spent a little bit more time on the controversies, which this falls under, in podcast 8. And you can always go back and re-listen to the controversies of chronic pain, including the result of back pain. But specifically here for failed back surgery, this is interesting because in 1999, there were 460,000 fusion surgeries performed. And of those 460,000 fusion surgeries performed, it's estimated that about 184,000 of those people were defined as having failed back surgery syndrome. Again, people who had gone through the back surgery, and even though everything healed properly, meaning if a fusion was done after the surgery at various healing points, the doctor would conclude that everything healed perfectly fine, but there is still more severe pain, and sometimes the pain is even worse. That's failed back surgery syndrome. So again, on about 460,000 fusion surgeries, it's been reported in 1999 that about 184,000 of those people had failed back surgery syndrome. Flash forward 10 years to 2009, and there were 1.1 million fusion surgeries done in that year, up from 460,000. Well, no surprise, but the number of failed back surgery syndrome patients skyrocketed to 440,000. So what's happening is, as we're doing more spine fusion surgeries as a way to hopefully reduce people's chronic pain, there's a massive growth in people like me and maybe like you who've had multiple back surgeries, but their pain has worsened. So that's why I'm talking about failed back surgery syndrome, and there's a lot of literature about this that you can go to mypainweb.com, and in the links section, you'll see many, many websites and links to further know more about this. So failed back surgery syndrome has been one of the most painful and complicated strands within mypainweb. And for those of us who suffer from failed back surgery syndrome, we face increasing disability as well as continual severe chronic pain. So this FBSS, failed back surgery syndrome, has kind of fallen into a no man's land between surgery and medicine. Okay, so let's start closing it here. So what do you do if you must have a spinal fusion? Well, in the event you should find yourself facing the fact that a spinal fusion surgery is in your near future, then you definitely have to find more than one qualified surgical opinion recommending the spinal fusion surgery. And I would recommend pursuing the anterior lumbar interbody fusion procedure. The anterior lumbar interbody fusion seems to produce a little bit better outcome. And again, you can go to mypainweb.com, and under the links section, you can find specific information about anterior lumbar interbody fusion. Now, in the event you're facing a cervical neck spine fusion, a procedure that I would recommend that I've had is called ACDF, which is anterior cervical discectomy fusion. Again, hit the link section at mypainweb.com, and you can read about anterior cervical discectomy fusion. So, while we have made advances in treating spine-related chronic pain from the early days, chronic pain still remains somewhat of a mystery. And it's evidenced by the epidemic growth of people who continue to live with chronic pain even after surgical intervention. I know this topic is a big one. There's a lot of information that we just discussed. So if you want to review more information and get more details about chronic pain and back surgery, visit mypainweb.com. If you have some specific questions or comments, definitely send me an email at help@mypainweb.com. Share with us your experience in the event you had to undergo some type of back surgery, that it would be beneficial for all of us to learn what you have learned. Now, you can always post your comments on My PainWeb Facebook or at Twitter at mypainweb. Thanks for listening, and remember, some quality of life can exist with chronic pain. Thanks for listening, and I look forward to chatting with you on future podcasts in the near future. Thanks.